Hello, I'm Dr. Parsa Mohebi. I'm a hair transplant surgeon in Los Angeles. Today, I'm going to tell you everything you need to know about African American hair transplant. African American hair is completely different than regular hair transplant procedure on somebody with straight hair. Black hair or anybody with curly hair is more challenging to extract, so a special method needs to be followed, a special technique needs to be used, and special devices needs to be in hand in order to remove those grafts. So when we remove a straight hair with FUE method, the punch goes in and out and remove the grafts, and we can pull it out usually perfectly. When African American is being extracted, we're talking about something that curls on its own. Sometimes they're very tightly curled. We call it C curve. That is when the follicle underneath the skin turns around, sometimes almost close to 360 degrees. So in order to remove that, the operator should be able to use a special device without damaging the grafts and follow the curvature of the hair. So years ago, when we were doing FUE and a strip together, we were not even able to offer FUE procedure to African Americans. But today, with the newest technology, with multiphasic devices, we can easily remove African American as efficiently as Caucasian hair. The first step in African American hair transplant is to design the hairline. African American hairline is different than Caucasians, is different than Hispanics. So the operator, the surgeon should know how to design the hairline for an African American patient. The next step is to do local anesthesia. We usually give sedations to patients. They're very relaxed, and while they're relaxed, we give them local anesthesia. You may feel a little pinching here and there on the back and front of the head, and then after that, everything is going to be numb. The next step after local anesthesia is to make sites. So we do all the designing at the beginning of the procedure. So we make small incisions with microblades that goes deep 4 mm into the skin, and direction, distribution, and curvature of a hair, everything has been decided at the very beginning of the procedure. Next step is to change patient's position and start extracting grafts and placing them at the same time. Since we already made the sites, the designs are already done. As I'm extracting the grafts under microscope, the technicians can use a device called Mohebi implanter and load and transplant the grafts into the site that we already made. The last step in this procedure is to do fine-tuning. I'm going to go back, I review every single hair that is transplanted. We sometimes have to add a little bit hair here and there on certain strategic areas. Sometimes we have to rotate them a little bit to be all in the same curvature, the natural curvature, and basically perfect direction of hair.